We are back on for the next plenary session. This is actually the last plenary session of this year's Congress. I don't know about you, Yvette, but like my impression from yesterday and today is that yesterday we were kind of starting the engine and today it's just a really, really smooth drive with very interesting debates. Yesterday we were talking about, do patients want to share their data? I was attending a very interesting session about who should have the control over the data, and we very quickly realized that if patients had full control over their data and would be asked about consent to share their data every time someone would want to access that, that could potentially bring a huge burden on the whole management of the data. So a lot of interesting topics opened, and I really, really am curious to hear what else are we going to hear in relation to the data governance issue.
Today, yeah, because that's how we will follow. Well, I didn't think I would say this, but I kind of miss Zoom because there you could bring everyone back to the same room with just one click. So we are still waiting for some people to come. But in the meantime, we can reflect on. So my session went on really well. We were here in this room. We had 3 different groups, and we were just talking a lot about how to build trust around data and data sharing and engaging patients with digital health tools. So it's been really enlightening.
What was the sentiment? That there is no trust, that we're somewhere in the middle, that it depends on the individual in terms of how aware he is of how the data is managed?
Well, it was very heterogeneous, and sometimes we concluded we might not even have enough data about whether there's trust. We should ask them, because we have, as patient organization leaders, as we're working with them, we have a sense, but do we know, like really know, how can we collect evidence on that, whether they are and what they want and how we can represent the thousands of people or hundreds of people and not just our feelings or what we get from meeting with them.
And this is exactly why we are here today, to bring some further clarity on all these questions. And now I think it's time for us to give the stage to the moderator of the last session.
Definitely. So the last session will be on digital health governance, and it will be moderated by Elisabeth Kasilingam, the CEO of EMSP, the European Multiple Sclerosis Platform. So please give a warm welcome, and she will introduce you, the speakers.
Thank you very much for this introduction, and I'm happy to be back for this very last session of this Congress. And as the facilitator was saying now, it has been quite an interesting discussion that we had around the topic of digital transformation. And we are now going to discuss about data governance, which is a key challenge to ensure that this digital transformation of healthcare delivers for the patients. And also, I hope that through this discussion we will have today, at this moment, we will also see how we can bring this discussion outside of this room to the right stakeholders. So I would like to invite the speaker and the panelists of this session on the stage. So first, Isabel Proaño, who is the Director of Policy and Communication at the European Federation of Allergies and Airways Disease, IFA, and also EPF board member. And Dipak, Kalra, who is the President of the European Institute for Innovation through Health Data. And Viktoria, Prantauer, patient advocate and co-founder of Hippo Foundation. Sorry. So we will start this session with a presentation from Isabel, and then we will go through the discussion.
Thank you, Elisabeth, and thank you to everybody who remains today with us at this EPF Congress. We have the difficult task about talking about something that might be abstract, which is governance on digital health. And I would like to start by saying where and how we would like to be as patients and patient representatives in this governance space. First of all, we've heard over the 2 days of conference that we want to be meaningfully involved. in shaping digital health, because it is fundamental to ensure that the tools, the procedures, and the care needs are reflected from diagnosis to living with the disease to the many times that we've heard improving the quality of life of patients. But this involvement should not just be used as a token, but rather facilitated by more inclusive governance models that allow for really effective participation and spaces that really allow for all parties to be represented and with a space. The unique experience that patients can bring to inform policy making is fundamental to humanize this system that is going digital at a very, very high speed, but also because I believe that everybody wants the patient to succeed, and that should involve the patient for sure. Actually, this EPF Congress shows how much patients and patient organizations want and need to inform the frameworks and policies that truly respond to their health needs and worries. And also, it shows that at the end of the day, there is a lot of real life in digital data. Now, we have this proposal from the European Commission, the European Health Data Space, that was proposed at the beginning of May, and that Martin Dorasil from DG Sante presented yesterday briefly. We as patients, of course, welcome this initiative very much. It is revolutionary. It structures, from a legal point of view, how the transformation of digital health, of healthcare, is going to happen in the next decades. And it is very transformative. We have been discussing it yesterday. There is implications on artificial intelligence. It will structure in a different way the patient and doctor relationship. It will empower the patient to have control over their data, their health, in a better way, more optimized way maybe that we are used to today. All with a very strong rights-based approach, because you have the right to have your data, and also with a collective thinking that now every stakeholder needs to be part of this transformation. It comes also, this regulation, with some gaps or uncertainties in how patients are going to be involved. How is that governance going to work for patients and representatives? For example, the regulation includes the creation of a European Health Data Space Board, so European level organ, that will be in charge of overseeing the process and ensuring a harmonized approach, because the difficulty here is to have all member states working together with the same procedures and sharing information, so that you have really single market data system in Europe. However, we are concerned that patients and patient representatives are not foreseen as part of that data board, and that their participation in meetings would be dependent on the topics discussed and their degree of sensitivity. So we are here facing a proposal that takes the patient representation as discretional. And that is of concern, because it's not the patient centricity all about this legislation. This is also reflected in the structure of the governance that is foreseen at national level, because there is this regulation proposal is foreseen to have two different structures at national level. One is the Digital Health Authority, and the other one is the Health Data Access Body. And these are going to be multiplied by 27 member states. Now, they will be set up at national level. And again, the regulation does not foresee permanent or mandatory participation of patients and the representatives. It would be subject to national laws. So that might create already some inequalities, because we know that member states have different healthcare cultures. So this is worrisome from our perspective and a bit incoherent, I must say, with the ambition of transforming healthcare, a healthcare where the patient will have now clear role and clear rights on the digital data. So patients need to be represented at all levels, certainly, but meaningfully. And I invite everybody here to be strong, organized at national level, as we are also at European level, to demand to be part of the table and to rally to take that space and make good use of it. Thank you.
Thank you, Isabel, for this presentation and for these remarks. I think it's clearly coming out of your presentation, there are some challenges that we need to address in how to include the patients and their voice in this future approach of data governance. And I have some questions for the panelists that also come from the online attendees that have been following us. So I will just bring that up, and I would be very curious to see your perspective as a patient representative against those from the other sectors, innovation sector specifically. The first question that I have is, what makes a data governance model inclusive? So how can we include better the patient's representations in the data governance? And also, how the future of the data governance look like? So any one of you would take that question first? Viktoria?
I can give it a try. How can we create inclusiveness? I think I want to bring in a few more terms to answer that question. And it's on one side data justice, and the other one is data solidarity. And I'm referring to an article from Matthias Braun and Patrick Hummel, because they thought about these terms and their interconnection. And basically, what they shared about data justice. What is data justice? It's basically to recognize when injustice is happening. And I think this is very important because this leads me to the second term, data solidarity. So this is not something we recognize once and then it's done. But this is an ongoing process of empowerment to ask challenging questions. Is it really just? Is it really inclusive? Do we forget anyone within the representation of the data? Who can benefit from the advantages, and maybe who has disadvantages because of that? So I would say through an ongoing participation and ongoing challenge to identify data injustice.
Thank you, Viktoria. I think that also built on what was mentioned earlier this morning, that trust should be built in the system. And I think, Isabel, you had some ideas about how to build more justice in the governance model. Would you like to share that?
Indeed, because when looking at the legislation that has been proposed and that is going to be subject to discussion, one thing that strikes is that, yes, there is some governance bodies, but then there is also some sticks and carrots. So that our data rights that will be for primary and secondary use of data are respected. And one of those is that the Commission is also proposing to have fines for those that misuse the data. And that is welcome because this is a legal framework. But then I also wonder, what about then the access to justice in case your data is misused by the patient and the patient representatives? Would not that help building a more trustworthy system and actually let people know that this is being controlled as a counterpower? So maybe this is something that we would start discussing also within this framework, so that it's included. This also perspective is not just about monetary and economic gain or loss. We're talking here about the most vulnerable data, sensitive data of a human being. So what to do with that? I think it's fascinating to be participating in these discussions and setting the future structure of the health data space from the patient side.
Thank you, Isabel. And Dipak, you have been working with the patients' organizations on this topic quite for a while now. How do you see the role of the patients' organization in data governance?
Well, if we're thinking about the European health data space, I have a little difficulty because it's such a complicated and rich document, 122 pages. I find it a bit difficult to talk about a governance model as if there's a singular thing. There are so many things inside it. Firstly, though, I think what's really valuable is it draws a distinction, but interlocked distinction, between the primary uses of data and the secondary uses of data. There's a lot in that document about helping to try to make sure that for direct patient care, the data delivers better than it does today. I mean, you know, in 2022, many of you probably are not resident of Brussels. If any of you need an urgent health intervention in Place Rogier in the next few minutes, and you see a health professional, can that health professional see your medication list, see your allergy list from wherever system and country your stuff is in? The answer is almost certainly no. And if you had to say, is there a justification for why the answer is no? No, there is no justification. The capability to do it is decades old. So I think from the perspective of safe quality care, I really am excited by the regulation strongly emphasizing, and it places mandating, better adoption of interoperability standards right across Europe, including cross-border and within-border connectivity, emphasizing the importance of data quality and the completeness and accuracy of the data on which we depend is there. There's a lot in the regulation that says patients must have easy, readable, friendly, free access without impediment or delay to their own data, which is vital, and the ability to enter data in their electronic health records. Well, I think these should be broadly welcomed. Now, I won't go on about that, but I will just flip over to the secondary use side. There is a strong proposal in that for health data access bodies to be the decision makers on behalf of society. And in the panel we had just a little while ago, that came up as probably a realistic model to go for. But what we had is a nice discussion, and I think this is where actually the regulation needs to be enriched with work that I hope we will all do together rather than just be unhappy that it's missing. Let's fill the gaps that are missing about what does that transparency mean, how accountable should these bodies be, and what I didn't feel strongly worded in that regulation is how is the patient representative viewpoint embedded within the way those bodies will work. So that's not a failing, that's a limitation, it's a gap. Let's fix it.
Thank you very much for that. I think that's a very good call for the future, for our authorities to really consult and bring the voice of the relevant people in the discussion before drafting the next proposals. Just the example that you gave to us now, just by it's a short story, but it's a case study, and it opens a lot of questions. We won't get into that now, but I guess it's a the example that you're using is quite an important one. In terms of the recommendations to regulators on the data governance and the patient involvement in this data governance, what would you like to say? Based on the discussion we had today and yesterday, what would be the recommendations that you would make to the regulators?
Very boldly, I think that regulators could take patients and representatives as the compass for the legislation. I think that our role there, apart from participating and actively shaping what is going to be there working for us is also to be a watchdog, because we are civil society organizations with the only interest to have better health outcomes. So I really think that by giving a space for the patients to do what they know best to do, that is the structure, the community, the feedback, to guide how to deal with innovation and with all the legal framework, is that we can also help regulators to legitimize what's being done, explain what's being done to our community, and work as another centerpiece in the puzzle of digital healthcare. So for me, it would be very important, and that would be the recommendation, that they include us not as a burden or as a token, but as an ally, because it's in our interest.
Thank you. Viktoria, you want to add to this?
Yeah, I want to, maybe a little bit provocative to say that, but my thesis is that without the patient organizations, this is not going to work. Because in the end, it's about trust. And whom are we trusting, right? If, I mean, in the future, I'm sure over the years, there will be trust for the data, the body data, what is it called? The data bodies, let's call it. Thank you, thank you. I'm sure there will be trust over the years, but at the beginning, how can you build trust? We trust each other, we trust people, right? People where we know that they represent our interests. And so this is why I came to the conclusion, without the patient organizations, it's not going to work.
So I have a follow-up question on this. How can data governance be built so patients trust the system with their data? So what is missing there that we can, so you are discussing about the justice, the consent, what else is missing so that the patients can trust the system?
I think certainly it is the flow of information. And we see in the proposal that it is very strong from a patient perspective on the primary access or primary use of data. And then it's so for the secondary use of data, meaning that a patient's data that has been used to advance research will not automatically get informed about that use and about those results. So it's very difficult then to imagine, why are you doing these things and why are you being boarded to then give away this information that is your most precious. So I would say that improving and the flow of information being more transparent and try to get buy-in on how this is going to serve us as patients is fundamental.
Thank you. Dipak, would you like to add on this? And I have also an additional question on this. Is we're talking about building the trust of the patient. What's also the role of the healthcare professionals in this system?
Well, the first thing I'd like to do is to strongly support what my two colleagues have said. I think they've made really great points, and I don't want to add to it, but perhaps what I'd like to do is just put a slightly different spin on it. Both the healthcare delivery ecosystem and the health research ecosystem have to be multi-stakeholder. There are so many different actors who need to work together. It would be easy to think the patients are the one family who's left out, but actually when you look at these ecosystems, there's a lot of inequality in representation across the stakeholders more generally. And what I hope is that we are now recognizing the need to bring everybody to the round table. But having said that, I think it would be honest to admit that as a generality, but it is a generality, over the last few decades, the patient voice has generally been underrepresented among decision-making, among policy setting, and among actors generally. There are, of course, great examples of patient engagement, patient empowerment. Some of you as members of organizations will have been part of those, and you would disagree with me and say, no, I've actually had some great experiences. So it is a bit of a vague generalization. But I think to some extent now, we have to slightly overcompensate for the historic under-involvement of patient organizations. And I feel that we therefore need to do a little bit more towards the patient representation than the other stakeholders in order to help restore that balance and win that trust. But I'd like to add another word, which is public, because I think that a lot of our, and I'm having to re-educate myself, I was a GP, the word patient rolls off my tongue really easily, but we are really now keen on prevention and wellness, and people who we don't consider to be a patient are equally part of this landscape. And I really hope that we can be that inclusive as we slightly overcompensate for our historic poor practice, that we bring in representation also of people who may not feel they're ill. I mean, you know, a colleague of mine, some of you will know very well, who says a person who doesn't have an illness is simply waiting for a diagnosis. So you never know. But it would be nice if we could be inclusive, a little bit overcompensating, but not suddenly think that we should push the patient into an exclusive place. Because actually what I've found in a lot of the meetings we've organized over the years, pre-COVID mostly, is that when we bring patients, and often EPF representatives, people like Valentina and others have been in our meetings, what we've benefited from is the patient voice being heard alongside others. It's a mutual education, mutual awareness thing, mutual learning, and I think the patient organizations who are in those meetings benefit from hearing what the others have to say as well. So please, let's keep a sort of multi-stakeholder perspective whilst giving patients and public some priority.
Thank you very much for reminding us of this. Indeed, as it was said this morning, if we don't work together, we're not going to move as faster and efficiently as we should in the future. So we acknowledge that there is a need for a multi-stakeholder approach, bridging the gap between bringing the patients on board, but also not forget the more broader public.
Elisabeth, can I add something on the healthcare professionals? Because this is something that the proposal of the European Health Data Space also addresses. And actually, it said very clear that there will be an obligation for healthcare professionals to update the health records of patients. That can be so transforming because you would have access immediately, free of charge, 24 hours, every day, everywhere in the world, to what actually your diagnosis is, and enter into this written and corridor opaque discussion today that you might have with your doctor. One thing is when you go in the consultation, another thing is what might be written in your health records. So that puts already some transparency and insight on how is the medical profession working. And what we have found at IFA in the research that we have conducted with 1,000 patients is that the patients really want the healthcare professionals to have a clear role in their digital health, meaning they want them as trainers. They want to be trained by the healthcare professionals on how to use their data, how to correct it, how to improve the sets, and at the end of the day, the knowledge they have about their disease. So it's clearly a tandem that is being here distilled with clear roles and very important ones, actually. So I'm really excited to see how this is going to operate, maybe in 5 years' time, and the transformation we're going to have. And for example, within our members at IFA, we have examples coming from Turkey, where in Turkey there is already a very well centralized data application, and where we see that the transformation it has brought to how the patient is dealing with the disease and how the patient is dealing within the healthcare system is amazing. We really want it here, so we have already examples ongoing elsewhere in the world, not very far.
Thank you very much, Isabel. I think we should take note of those good practices and make sure we use those examples somewhere and that we can go back because many patients' organizations have been working on this topic, and we can probably learn from each other more. I have a question regarding the takeaways from your respective sessions during this conference and specifically this morning. So what are the takeaways, the key takeaways that you can share with us for data governance? Who wants to start?
I can start. I was part of your session, which I found very inspiring. It was about the data journey. And I think what we learned throughout the last 2 days is that we want to be involved, definitely. We want to shape the future, and we want to make decisions. But during this session, we learned, do we really want to make them all the time when there is a new request for secondary use of data? And after the session, most of us agreed that this is not feasible. And I think this is very, very interesting because this shows a lot of new opportunities. So if we agree that it's a good thing to establish new data intermediaries, new organizations which handle the data access for us, how exactly does that look like? And as I mentioned before, how can we make sure that we start engaging with these organizations?
Thank you very much. Isabel.
My takeaway is maybe the word responsibility, because it is our responsibility as patient organizations to demand to be part of the discussion. And while all the structure is being created, I think we have many opportunities to start already on the journey. I mean, in your organization, Elisabeth, you are doing that already. But I see that it's also for us to develop the principles on how do we want to be involved, where do we want to be involved, what are our needs to be involved, so that also we can measure the expectations. For the community and for the system, we definitely do not have the same resources as the future data authorities or even the healthcare system, the medical practice has. So I think that setting the basis for that could be a way to start working on a data governance model that really works.
Thank you very much, Isabel. Dipak.
Elisabeth, no. I can't. I mean, Viktoria was in the session. She's more truthful than I would be about the session I ran. So I'm happy to let her word be the summary.
Thank you. But I will turn to the audience now and see if there are any questions from the audience. We still have a bit of time, so anyone has a question? I think there's...
So the question is, coming up, so how this future governance will lead with European laws and regulations related to confidentiality, privacy, personal data? 3 dots and a question mark.
So who wants to take that questions?
So go ahead.
No.
Well, I think if you read the EHDS regulation, there are quite a lot of pages in the early part of the document that indicate the fit to other existing regulations like the GDPR and the fit intended to forthcoming regulations like the Data Governance Act. I don't think the fit is perfect, but I think it's not bad. I think that there are going to be some areas of detail that we still need to work out, which, as I've said previously, I would like us to do together, not leave the Commission alone, neither positively or negatively alone, but say, no, we'll work together on the detail, and I think there are lots of sharp brains who will help us to work out the fine-tuning fit. But I think in general, there has been some careful thought done to try to avoid obvious clashes.
Thank you, Dipak. And just before I move on to Isabel, to also add to this answer. I just want us to take note that there is work to be done here together, and that could be something very concrete that we can also propose for our future collaboration on working with the Commission and the other institutions. So now, Isabel.
Yes, the question is challenging, and I think we are witnessing a big effort here at European level, maybe pushed by the situation we've had with COVID on coordination and prevention and delivery of care and response. And it is difficult to have all the puzzle all together, but as I understand, there is a very important rights-based approach, and another one that is more linked to coordination and economy, so what in Europe we have as a single market. And we must not forget that the European health data space is only one of the spaces that are foreseen within the European Union legislation. There will be others, like for example the green data space, and all these will be adding up. I think it's the first time that we have a regulation of these sorts, really pushing to the limits how we work together at national level and at international level, the 27 member states. So we must take into account that not everything, as Dipak was saying, is going to be perfect from the start. But I do really see that already in this proposal by the Commission, there has been a lot of listening, at least on what the patients are expecting for the primary use of data. So the data used for your care, and that is very much appreciated.
Thank you very much. Viktoria, do you want to add something in that answer?
Just to one thing you said, that it won't be perfect from the beginning, but I think this is also what makes it so interesting and a collaborative effort, right? So it's maybe not perfect at the beginning, but it's a very good start. It will be revolutionary in the long term, but we all have to come together and make it work. And I think this is really a change how we approach things, and I really like that.
Thank you very much, Viktoria. There is a question there on the right side, if someone can show up.
I'm curious to know whether we think that we're creating our own European data silo. And when we think of health, we think very much, and we think of rare diseases. That's very much a global question for those diseases. So how do we make sure that we don't increase a digital divide by creating our own European silo of data? And how will we allow that transfer? Because data can transfer across borders and should transfer across borders. So how will we build framework to make sure that governance actually reaches communities outside of the European space?
Thank you very much. Very challenging question. You want to take it, Dipak?
Well, it's a lovely question because it's both a challenge and a vision, which I really like. Now, on one level, a critic could say, we've got 27 silos right now, let's just have one instead of 27, and that, okay, is a start. But if you look at the detail of what's specified, apart from things like GDPR, which is a little bit European, and I say a little bit European because a number of other parts of the world are echoing many GDPR sentiments. Many of the provisions in it are not particularly locked in Europe. They're just specified as a European instrument. For example, the interoperability standards that are used in the EEHR exchange format are international standards. The data quality criteria, which are not spelled out in detail, should, if we're lucky, draw on international research on data quality assessments and so on. The EHR system quality criteria are very light touch specified in that document, and one of my pushbacks, friendly pushbacks to the Commission, is there are a bunch of ISO standards, international standards for EHR data and systems that we should be using when we develop criteria. So I think that we should design the implementation of the EHDS to be using as much global content as possible. so it's global adoption friendly. But I think secondly, we have to be friendly. And I think we need to work with our colleagues across the world and say, there's not a lot here that most countries in the world would say, that's terrible, you mustn't do that. So let's try to encourage a permeation of this across the world by working with colleagues. Because as you say, for the rare diseases, even the planet's barely big enough.
Thank you very much, Dipak. Anyone wants to add to that? Yes, Isabel?
Yes, because this is a legal framework, so there are liabilities, and therefore the governance need to have boundaries too. But that doesn't prevent that the results that I hope they will come early, the results that we will have as a society, European society, from the sharing and using of secondary data, for example, on pharmacovigilance, something as simple, sorry to say, it's to simplify things, right? But like learning from adverse reactions, like learning from what we have witnessed, massive vaccination campaigns, and how that is operating in the population. All these results will be across and will be used outside of the European Union health data space. So I believe that at the beginning, at least, there has to be some kind of boundary, while then trying to translate those benefits also for those countries that would like to learn from our experience.
Thank you very much, Isabel. Is there one last question maybe from the public? No? So I will just ask one last word from our panelists. What do you think we should be the immediate next action for this group here today to work together on the future data governance construction?
There is clear an opportunity now to reply to this proposal with the European Commission. I think it's around the end of July. So I really recommend and encourage everybody to have a structured discussion with your constituency and reply to that consultation. And there will be many others also at the level of the member states on how to proceed with that. There are already systems that are being tested, that are in place. We learned yesterday from My Health, My Data, or the joint action towards health data space. And these are opportunities we have already to engage with the future implementation of this legislation. So, yes.
Thank you, Isabel. Viktoria?
So one last thing to add, you mean? Well, I think I'm really keen to see how we now take the resources we have and, really start to fine-tune our future. Yeah. And what my message maybe would be, let's keep the dialogue open and try to move forward together.
Thank you. Dipak?
Well, I think you've actually heard my sentiment frequently in this panel session. There are many things right in there, a few things that are not yet well specified, a few things that aren't likely to be successful the way they're written. But let's try not to have it chucked out, rebelled against just because it's not perfect. Let's instead push hard for an open spirit, a collaborative spirit. Let's make it better.
Thank you very much. So I would like to thank you all for your contribution today, for a very meaningful discussion. I would like to invite our audience here to really follow up and make sure that you connect with each other and keep working on this topic together. I will give back the mic to our host, and thank you very much for listening in and for your participation.
Thank you, panelists.
Thank you so much.
This brings us to the end of this year's Congress. How do you feel about that?
Well, a bit sad. It's definitely hard to imagine. It might be the last time we are standing on the stage together, but I'm really, really thankful.
And as you might imagine, we have 3 questions for you again. So the first one is, did you hear anything that surprised you in the last 2 days?
Yeah? Good. Did you make any new connections?
And did you have some fun? Okay,
Yay.
we won't have a long speech. That's great to hear. So we do want to give great thanks to the organizers of this session. So another question?
Yeah, so we thought, if you agree and if you like the Congress, and from the yes I can feel like it's a yes, then please form a heart with your hands. In case you don't know how to do that, there are multiple ways. You can do it like this with the 2 ones. You can do it with just the 2 fingers, or you can ask someone next to you to help you.
So let's see which one you will choose. Please,
that's one
over
too,
your head, like that.
Yeah, we can do this
Let's
one
give
too.
a nice thank you to the organizers.
Yes.
Let this be just the beginning of the discussion, and yes, let's continue the discussion.
Yeah, and let's welcome Anca Toma, the Executive Director of EPF, like this, on the stage for the closing remarks. Yeah, yeah, it's not working with clapping. It's either good. Thank you.
Thank you. So I'm going to stand up. I'm not going to hide behind the podium because then I'm afraid I would take too long and stand between you and lunch, and that is just not done at the end of a conference. So, data. What I heard a lot these 2 days, and remember I'm a newcomer to this environment, trust, consent, inclusiveness, collaboration, conversation. These are the words that I hear again and again and again, and I think it's quite remarkable because that was the whole purpose our EPF Congress was created for, to have a conversation about issues that are really important to our patient community, and in this case, it is about data. It is also quite clear, and Viktoria said it before, you stole my thunder again, Viktoria, seriously. The digital transformation of healthcare will not happen without the involvement of patients and without the involvement of the patient community. So I think it's really important that we're having this conversation. The third thing I wanted to say is we were trending again on Twitter. Well done, comms. And well done everyone for engaging on social media. I think it's important, we're competing with the European Council and some pretty important stuff, but this is also pretty important because it's about our lives. We're all patients, but patients are not patients all the time, and it all impacts our quality of life, as Peter Kapitein said yesterday. It all impacts our health, our future, our kids' health, and our kids' future. So thank you to all who traveled to Brussels and to all who tuned in online. Thank you very, very much to EPF's board, to the Congress Advisory Board, to our sponsors, to our partners, to our colleagues, to our speakers, to our support team, and a really, really big thank you from me to the staff at EPF. Please stand up, guys, because seriously, you've delivered a fantastic Congress. And I really want to celebrate my team, our family, because they've been spectacular. So there you go. This wasn't planned. You didn't know it was coming. And because as I said, I don't really want to stand much longer between you and lunch. I'm going to be really annoying right now and do another unplanned thing. And I was wondering if everyone would be happy to kind of make your way towards the stage so that we do a big family photo of our Congress. if that's okay, and then we can all move towards having a goodbye lunch, if that's okay with everyone. So thank you very, very much, and I hope to see you at the next one. Next year, EPF is turning 20. Yes, we will have an anniversary year, and we will have some things in store for you, but I will not disclose what they are for a number of reasons. But you know, stay tuned, stay close to us, and you will find out what's next. We took a lot of learnings from these last couple of days, and I know that you will hear a lot more from us and from our team. So thank you very much, and with this it is my pleasure and honor to close this Congress 2022. And please, if you can and want, join us for the family photo. Thank you.